All right, Dr. Cruz. Cruz Orthodontics has something called the Kids Club. What is it?
So, oftentimes you want to see a child at a young age as an orthodontist to ensure a few things. You want to make sure that they have all of their adult teeth, they're not missing any teeth. You want to make sure that all of those developing teeth that still need to come in, and oftentimes it takes, another 2 or 3 years for those adult teeth to come in, that they're oriented correctly, they're not impacted. You just want to make sure that things are developing well, the bite, the jaw relationship. So there's a number of things that you want to look at an early age, 7, 8 years old. But the thing to kind of remember here is that an overwhelming majority of those children really don't need to have orthodontic treatment. And so,
Hmm.
with that being said, you want to make sure that you're still watching their development, and you want to do it in a fun way. And so, our office has come up with something called the Kids Club, to where if a child doesn't need a phase 1 early treatment, we at least would like to see them a couple times a year and see how they're doing. And so we've created this Kids Club. We create a lanyard for them. We give them a prize. There's also drawings that we do with like bigger prizes that are pretty exciting. And so for the youngsters, it's pretty cool because they feel
Yeah.
like they're part of a team now, and so it's pretty adorable. Oftentimes, we'll actually see patients wear their lanyard at their next appointment and then their next appointment. So for years they bring it in and they wear it
Really?
and they show me that they've got it, and
Oh, that's
they're
fun.
hoping that there's going to be some sort of reward as a result. And so it's pretty adorable to see how excited they are as far as being part of the club.
Do you remember why you originally created it?
The big reason was you've got to find a way of being able to monitor patients, but do it at an early age. And so, another way of saying this is that there are times that if you were to see a child at 11 or 12 years old, you may have missed opportunities to be able to treat something simply and easily that are now
Mm.
going to be more aggressive, needing to have teeth removed, for example, that could have been saved if we had caught this at a younger age. And so we had to come up with a way of encouraging families to come in while their child is still young, with the understanding that they may not need any treatment, uh, but let's rule out any potential larger issues that could be developing.
What age should parents start thinking about taking their kids in for these orthodontic evaluations?
We normally say ages 7 to 8. That's the easy short answer. A little bit more kind of involved answer is that it really depends on dental development. So personally, what I like to see is all four of the upper adult front teeth to be in, before we start thinking about even considering an early phase of treatment or deciding if an early phase of treatment is warranted. And so
Yes.
that can vary age to age. We've had some youngsters at 6 years old, and all of their adult front teeth are in, and then we've had some youngsters at
Oh,
10 years
wow.
old that are still waiting for one or two more teeth to come in the front. So there's can be a big disparity between ages as far as where their dental development is. But as a general rule of thumb, 7 to 8 years old is usually a good age.
All right. So, how does the Kid Club help parents stay ahead of any potential issues in the future for the child?
One of the things we take in all orthodontic offices take them is a panoramic x-ray. And so oftentimes when you go into the general dentist, they'll take what are called bite wing x-rays or periapical x-rays, which are little x-rays of the individual teeth. But our x-ray covers basically the entire head, and it is really cool to see kind of parents and patients talk about that. The youngsters are like, that's me. And so you can see where the eyes are, you can see where the ears are, you can see obviously all of the teeth and the jaws. And so
Yeah.
it's really cool to see how excited they get when looking at that. But what I'm able to see is all of these teeth that are still kind of waiting in the wings, and they're developing and they're getting ready to kind of come in, and they're years away from being able to come in. But based on what I see, you can either anticipate that things are going to be just fine, or you can anticipate, potential issues, or themes that can happen. And so that has been absolutely critical in being able to figure out whether or not somebody would benefit from what we call an early phase of treatment.
What happens during these Kids Club visits?
We try and keep them lighthearted and fun. I know you and I talk about orthodontics kind of in more depth, and these poor
Yeah.
youngsters, their eyes would roll in the back of their head if if I was talking about
Sure. Oh, sure.
scanners and printers and dental monitoring and all of these other things. And so we keep it lighthearted, we keep it fun. Oftentimes, I'm trying to take the time to get to know the family and get to know the kids. So if I get to see them 4 or 5 or 6 times over the course of a few years, by the time they're ready to start treatment, I feel like I really know them. I know what sports they play. I know everything about kind of what they enjoy, what they don't enjoy. They also have the ability to get comfortable with me. So if I can be lighthearted, oftentimes what you'll see is this transition from being kind of skeptical about me, maybe a little bit nervous
Yeah.
to come in, not sure what's going to happen, to where, after a couple of years, they come in, they'll give me a high five, they'll say what's up, they'll ask me
Oh, that's great.
questions. Sometimes the questions are random, but it kind of lets me know, they're comfortable. You can kind of tell when somebody's comfortable just based on how they talk with you.
All right. Does early monitoring always mean early treatment?
Yep. Great. Yeah. Great question. Absolutely not. In fact, there are situations, in my opinion, where there are other orthodontic offices and dental offices that just sort of uniformly treat young patients, whether they really need it or not. And
Oh,
in our office, we really want to make sure that it's justified. And so, briefly kind of talking about what is justified. So, justified is if a patient has an underbite or a crossbite or severe crowding or severe spacing, something that's really significant that if we fix this now will make things dramatically better for that patient in the future. And so, I don't have the exact number, but if I had to put a number on it, I'd say that 20% of our patients probably justifiably would benefit from an early phase of treatment. The other 80% go into this kids club that we're talking about. And so I think that's really important to understand, because we really don't want to abuse having young children come in and starting treatment if it's not needed. And so in our office, it's probably, like I said, 20%.
all right. So I think you answered most of this, but how does being part of the kids club help a kid feel more comfortable with orthodontic care in the future?
Yep, it's all about making it fun. And so it's funny, as I get older, I forget what a big deal just getting prizes are, and
Mm,
making a big deal and kind of celebrating them. And so that's probably the best way to describe it, is that we really make it all about them. And I'm not so sure that that really happens, when and maybe I'm wrong, but when kids go to the doctor, there's a lot of kind of medical lingo going on, and they're just sort of an
mm,
observer, a bystander in the whole process. Where in this
yes.
situation, we really want to let them know that it's all about them. And oftentimes, I really try to talk to the parent, of course, but I also want to make sure that I'm really making eye contact and letting them know what I see, and giving them ownership as far as what's going on with their teeth, making sure that they've got questions, what's going on. And so I think that that's a really important aspect, is making sure that they feel comfortable. And the only way to do that is just kind of pouring in attention and care into the patient, because even at a young age, you can tell whether or not somebody genuinely kind of cares about them, or whether you're sort of being blown off. And so
Mm,
that's important to us, especially that initial visit when you're only 8 years old and you don't know me. In fact,
right.
I have funny stories about that. So with where we have our exam office, I have to sort of turn a corner and walk down a hallway, and the patient can see me coming as I'm walking down the hallway. And so
Sure.
I have countless stories of situations where the child is with the parent and they're being goofy and silly, and they're just, they're spending time with their parent as they're waiting for me to come in. And as soon as they see me turn the corner and walk down the hallway, all of a sudden they like sit upright and they get very serious. And so
Real.
I'll usually try and
Sure.
come in and immediately make things lighthearted, like, hey,
Yeah.
don't worry, you don't have to be that serious around me. And so usually by the second or third appointment, they're like, okay, I know this guy. Everything's easy. Everything's cool.
Awesome. All right. Last question. What would you say to a parent who's unsure about taking their child to an orthodontist?
I would say there's no harm in it. And so really the primary intention of going to one of these consultations is to just get information. And so I think that there's this concern about, well, are they going to just recommend treatment, uniformly for everybody? And it really doesn't work that way. Oftentimes the feedback that we get after these original consultation appointments is like, wow, that was a wealth of information. Thank you so much for taking the time to explain that. And then we have parents say, okay, what do I owe you? And it's like, no, you don't owe us anything. This is a complimentary consultation. We're
Uh-huh.
really just trying to gain trust and give you information so that you understand that our intentions at our office are pure. They're good. We're really trying to do the best that we can for our patients, and we don't have ulterior motives.
Great. Well, thanks again, Dr. Cruz. We'll see you on the next episode.
Take care.